For introduction, my name is David Phillips. I'm based out of Gates Ventures, which is where the Exemplars in Global Health program is incubated. I oversee our maternal, newborn, and child health cluster of topics, a few of which you'll hear about today, as well as new topics, essentially what our program may end up studying next. We're really excited to be providing this overview and roundtable about the Exemplars program. It's something that's been incubated for now approximately 7 years, and I think has been gaining a larger and larger network around it and a lot of excitement about the use and uptake of its results. So I'm really, really proud to be able to present all of this work to you all today. Joined by a number of other speakers from the group, and we'll get introductions of each of them one at a time. And then after presentations, we can do, we'll have about half an hour for questions and answers and live discussion. So first, kick it off with a quick video about the program. Great. So I'll provide just a brief overview of the program as a whole and then turn it over to other speakers to dive into individual topics. So to start, the Exemplars in Global Health, it's a program to find the positive outliers of global health. It's now spanned a number of different topics, as you can see on the screen. And it's been ongoing for about 7 years, like I said, starting with studies that have focused on exemplars in stunting reduction, under 5 mortality, and community health workers, and since expanding to a range of new topics: vaccine delivery, neonatal and maternal mortality, COVID-19 response, primary health care, anemia among women of reproductive age, family planning, and then a few new topics that are just coming on board now. The model of operating is really a consortium research project. Every one of these topics that I just listed has its own multi-university research network built up around it, all in the intent of first find the positive outliers, the countries in the world that have really exceeded expectations, and then work on the ground in those countries to understand what they're doing so well. You can see in kind of the fine print here the countries that have been identified under every one of these. I won't list them all, but they're all selected through an empirical process to understand, based off of outcomes of that topic of interest, who's really going above and beyond what is normal and finding a way to succeed, often with similar tools and similar interventions to all of their peers, but somehow finding ways to be more effective with them. On top of that, I think there's something that makes the Exemplars program particularly unique, and that's that it's only ostensibly a research project. In fact, the entire network that's been built up now for many years around Exemplars in Global Health is still on hand to drive towards what we often describe as decision support. The idea is that from its conception, we really didn't want this program to simply produce research reports that sit on a shelf and maybe get read from time to time, but actually proactively drive towards program change, policy change, implementation, updates to guidelines and so forth that are based off of the practices that are happening in the best performing countries in the world on one topic or another. And we've built up a system around that now that kind of operates in, like I said, a proactive fashion to connect the stakeholders of the work to the relevant research findings that all of the research partners have uncovered, and work with them, sometimes to create novel materials based off of the original written reports, so that it can be translated into lessons that are actually actionable for those groups. So we've developed this kind of decision support process that actually starts from learning about the demand. And it's very intentionally demand driven to understand where information needs actually are on any one of these topics, one stakeholder group at a time, and then come back to the research consortium and the findings that they've produced and understand what within all of that can actually be relevant and useful. And all in the effort of driving towards research uptake and an improvement in countries and global organizations around the world. That's facilitated by a range of different methods that we have now for research uptake. Some of them are more passive, related to the Exemplars and Global Health website, which is live and hosts a number of features to ask experts and explore the data. But others are much more proactive in terms of generating new materials and sharing, like I've said. And so finally, a brief overview of what each of the topics is finding. We often, after walking through what the program is, the first question on everybody's mind is, well, as you've looked at now dozens and dozens of positive outliers, one topic at a time, what do they all have in common? And it's a very difficult, high-level message to distill, but we've boiled it down into about 8 themes. And each one of these has specific country level examples coming from one of the topics, and you can see them listed here. I won't run through them in the finer points, but at a high level, each of the exemplar countries has really had in common a strong political commitment in health leadership, effective stakeholder coordination, and well-coordinated both donors and policymakers and program implementers, strong focus on data collection and use for decision making, a real dedication to women's education and empowerment, a local, connected, and capacitated workforce that's very focused on community health workers, community engagement and behavior change, effective and sustainable financing, and finally, an equitable approach towards targeting interventions to the populations that need them the most. Behind each of these themes, and if you go out to the Exemplars and Global Health website, you'll see our really extensive documentation and data supporting each of these that describe in any particular country on any particular topic how that played out in practice. So I'll leave it at that as kind of a teaser for the more in-depth presentations from some of my colleagues here, and look forward to having any discussion about it in the Q&A. Great. I've now forgotten the order. I think next up we have Dr. Musa Sar speaking to our vaccine delivery results. Oh, sorry, Sydney, you're up next.
Thanks, David. I'd love to invite my panelists to come on up and join me. First, we'll have Dr. Musa Sar, who, in addition to the affiliation listed on the slide, he is our in-country research partner for the vaccine delivery work in Senegal and has led that work. So welcome, Musa. Thank you for being here. We also have Dr. Gina Saman, who is works with the World Health Organization, but in relation to Exemplars and Global Health has sat on our technical advisory group for the COVID-19 exemplar work. Next, we have Dr. Steve Lim, who needs little introduction, has led, as we were talking about in preparation for this session, quantitative research across a number of exemplar topics. And so he's basically part of the Exemplars team here at Gates Ventures. And then finally, but not least, Dr. Gloria Ikalezi, I'm so sorry, Gloria, who leads our vaccine delivery and neonatal and maternal mortality research here at Gates Ventures. So the first question I would like to start with is to you, Gloria. A key goal of the Exemplars and Global Health Program is to ensure that research findings are relevant and useful to others, like our audience today. Can you walk us through how Exemplars conducts research and disseminates findings?
Thank you, Sydney, and great to see you all. I feel like part of that question has been answered by David's initial introduction of the program, but I think 4 ways that I would like to highlight in terms of how we do our research. Like David mentioned, proactive. I would like to start with that word, really scoping out evidence needs, gaps that our priority partners are looking to answer in different health focus areas, really trying to understand how can we support decision making, whether it's strategy, whether it's funding decisions, and sort of tailoring our research to make sure that we can be as useful in terms of producing fit for purpose results. And then, like we all see, we work with really great research partners at global level, in country, like Dr. Sar here on our vaccine delivery work. We also have a technical advisory team like Dr. Gina over here that really help us shape the methodology, the analytical rigor, and help us think about methods of impact or uptake of our work. And then, as we continue with the research process and begin to identify some of those lessons, really proactively disseminating our findings through global events, through in-country dissemination meetings, and also through targeted conversations with different users who could use this work. And usually these are either funders, again, TA partners, in-country policymakers, or even norm-setting bodies. So really, the point about proactive decision support is where we focus. Yeah.
Thanks, Gloria. And one of those countries, I think, where we've seen really exciting engagement and uptake has been in Senegal, and specifically the vaccine delivery work that Dr. Sar, you've been leading. Can you speak more to what led to such successful engagement, and where do you hope it goes next?
Well, thank you. I mean, I believe that the initial step of all of this is the successful success that Senegal has into having a high coverage for immunization, routine immunization, and being selected as part of the Vaccine Exemplars program. And one of the success that we have also is explained by the fact that when we work with Gates Venture and the other partners at Health Metrics and others, we work in very close collaboration with the Ministry of Health and all stakeholders in country. In fact, even at the planning level, they are involved, at the implementation level, and we organize this dissemination meetings where the information is shared. So it's not just about having publications in good journals, but it's also having that local dissemination meetings where the information is shared not only with the Ministry of Health folks, but also with the people at the district level, at the peripheral level, and also have their feedback. Sorry. Sorry, it's me. Yeah, and so an example of that is when we were sharing the information on the vaccine delivery, there were some challenges with the identification of some of the facilities in our analysis, and that led to some discussion with Gates Venture and working with them to develop a master facility list that has been kind of it was also a request from the Ministry of Health that they're shown that this was something that's going to be very helpful to them. Not only working with the Ministry of Health, but also other agencies in countries such as the National Statistical and Demographical Institution, reviewing a lot of, because there was a large number of lists of facilities that we helped consolidate, identify geolocations. So just to say that not only we work with the government, but we also listen when we, when we share lessons learned, and we also work with our partners and sponsors to address those new ideas. Thank you.
Great, thank you. And Gina, the next question, I think COVID-19 has been a big conversation at our meeting over the last day, and I think will continue to be for the next 2 days. I know you've been involved both in the COVID-19 work here at Exemplars and also with World Health Organization. Given the pressing issue of COVID over the last 2 years, can you share how Exemplars has helped advance the conversation for you and how you were involved in that research process as a TAG member?
Thank you, Sydney, and greetings, everyone. First, let me just say it's a great privilege to have been, and still am, a TAG member for the COVID Exemplars. I think I was telling Mike Ryan, our executive director, yesterday, there were 2 things that I'm grateful for in terms of the COVID response and my own role. One is working directly with WHO country representatives, the global footprint of WHO in 152 countries. And the second is to be a TAG member on the Exemplars. And the reason is, when you go in relatively naive to a project, you sort of go in thinking, what's this going to be about? And as it unfolded, to see the quality of research, the ownership, the fact that it's happening in countries around the world, and having in-country leadership that's partnering and enabling global priority research and actually operational answers, I think is really the key of what the Exemplars has been for me. So really, truly a privilege to have been engaged. Throughout COVID, it's hard to do research on operations when you have epidemiological questions that have to be answered. So when you think about the work that came out of Uganda, Sri Lanka, the Dominican Republic, around how the private sector, the health private sector, was engaged in the COVID-19 response, these were really critical to help us think about how our countries having to address the engagement of private sector into their health response to COVID. So fixing prices for testing, having accreditation of facilities to participate in responding to cases. So these are types of questions that usually get forgotten or go unanswered. And I think that's really key through the Exemplars. It's been really a privilege.
Thanks, Gina. Steve, the next question we have, or Dr. Lim, the next question we have is for you. Across so many of the topics that you supported, what are a few examples of how Exemplars research can be used to drive impact that you're most excited about?
Yeah, thanks, Sydney. So the area that I'd like to touch on, we covered actually in the previous session, and actually builds on Gina's comments about operational information. So, we've done a lot of work in the past on characterizing and mapping, for example, where unvaccinated children are, both at national and subnational levels. What I'm really excited about in terms of impact is moving beyond that where children are to the question about why. And not only why, but quantifying what is the contribution of different drivers of vaccination coverage, whether that's the extent to which facilities are ready, or the demand side of the equation, or access to facilities. So quantifying the role of each of those drivers to variations in coverage. And I think there's a huge potential for impact of some of that work.
Great. I would like to turn the next question to you, David. As someone who's been with the program for quite a few years now, I think a common question we often get is how do we choose exemplar countries and also which topics we study? So could you speak more to that?
Sure. Thanks. So maybe starting with how the topics are selected, and then I'll go into a little bit about how the countries are identified. In short, the topics that we've studied here have been chosen based off of demand for the information. Admittedly, early on, that demand was largely coming internal. Something that we didn't say is Gates Ventures is we're the private office of Bill Gates, and we work very closely with the Bill and Melinda Gates Foundation. And so, stunting underfy mortality and community health workers largely driven by where information needs were most pressing at the time for those audience. But since then, it's really become this kind of multi-stakeholder consensus-driven process of identifying what would be useful, where do we have a sense that there are positive outliers in the world, but we're not exactly sure what they're doing so well, and where is there kind of an urgent need for best practices from those countries. So it's really been based off of demand and bringing together the community around any given health topic. Then the countries themselves are identified through a very empirical process. The goal is to find countries, and in some cases subnational entities, that have not just performed well, but exceeded expectations, like I had said. And that's, of course, begs the question of expectations based off of something. And that's usually driven by a range of covariates that define kind of the macro level drivers of a particular outcome, say vaccine coverage. And so compared to a number of known major drivers, which countries are still performing particularly well compared to all of their peers on an empirical basis. From there, that's where the technical advisory groups come in to help ensure that we're not just looking at noise in the data, make sure that we're keying in on countries that really do have something to learn, and goes through a number of stages to identify countries in that way.
Thanks, David. We're going to open it up for questions shortly. So start thinking of whatever questions that you do have. I have a few more though before we do, and also want to just highlight across all of the panelists what we're hearing is just the importance of the work being demand driven and responsive to specific questions and evidence gaps that we're hearing from those end users. One of the reasons we wanted to have this session today here at Grand Challenges is two-part. One, we're a relatively newer program, and it's an opportunity for us to introduce exemplars to all of you. But then secondly, we want to hear from you. What topics are you interested in learning about and would find helpful to take an exemplars lens to? And secondly, what upcoming decisions do you have, whether it's program decisions, policy decisions, funding, where findings from this research could be helpful? It's those types of questions and that interest that keeps our program going. So to the extent that you have questions, ideas, we look forward to hearing from you all in a moment. But before I open it up, one final question, a bit of a round robin to our panelists here. We're fortunate to have all of you in the audience, and many of whom are innovators that we don't have the opportunity or often work with as closely. So I would love to hear from you, Musa, Steve, and Gina. How do you think innovators specifically may learn from exemplars?
Thank you. Yes, I mean, I think that one of the items that comes out of most of the work that we're doing with the exemplars is to identify these drivers for successful implementation. It can be vaccines or other. Once these drivers are identified, now I believe it's going to be like how other countries, even other regions can use those drivers to also successfully turn the tide around, for whatever activity they're implementing. These drivers can be used as is. They can also, but in most cases, they're going to need to be adapted in some way. So the innovation would be to see how these you can adapt by maybe by person. I mean, it can be, for example, right now, most of the work that we have done has been for routine immunization that mostly target children. COVID-19 vaccination is picking up. In most countries in Africa, it's even right now being more and more being integrated within the expanded program of immunization. So how are we going to use these drivers to also reach the adult population? In different type of, I mean, with all the challenges that we have with COVID. So we said place. I mean, also, I mean, like different regions also require different. So I mean, drivers cannot just be implemented just the same way, even within Africa, or even other parts of the world. So some thinking needs to go around those and see how, those drivers can be adapted also in different areas of the world. Most likely also some things that have worked in Senegal in 2019 or 15 may not work in 2022. So let's also do some adaptation for, considering time. So I believe that those are areas that most likely people need to be thinking around, to adapt these drivers when this implemented somewhere else. Yeah. Thank you.
Thanks. Yeah, Steve, can I hand the question over to you?
Oh, sure. So I'm a data person, so I have to talk about a data challenge. I think to the innovators in the room, to pose the challenge around how to effectively and efficiently measure, measure better the demand side of the equation. And so I'm looking at Heidi Larson down at the front of the room, who's done fantastic work on, vaccine sentiments, which we've been able to leverage as part of the Exemplars program. But I think, there's a whole range of issues around better measuring, system trust that came out in the earlier session today, and other components of the demand side that we need to get better at. And I think importantly also incorporate those into, routine data collection. So, I think it's somewhat of a travesty that we're not collecting that type of information, for example, in demographic and health surveys routinely. We collect a lot on the output side. We have surveys of facilities, but very little data collection, I think, routinely on the demand side of the equation.
Thanks, Sydney. I think the way I'll answer this is looking at it from the perspective of WHO's coordinating role and providing an enabling environment really for the work that needs to happen in countries, and to have platforms established so that researchers can do the quality research when it's needed, and to answer questions that are actually needed. So in that sense, I think the innovators in the room should look at the work done, look at two opportunities in it. One is, how do you adjust those methodologies and use them for beyond COVID, and clearly not just the next pandemic, but other epidemics? So what needs to be done to right size them for other events? That's one. Then the second is, there's now this network, an amazing network of research collaborators globally. And in a sense, there's an opportunity here to plug and play with them, to work with them in a way that sustains their capacities, their interests, their role, and their stature in this environment of research and answering operational questions. So in that sense, the second opportunity is about networks and keeping their research pipeline ongoing so that they can be ready for when the next big one hits.
Thank you so much. At this time, we'd love to open it up for any questions. So if anyone in the room has a question, feel free to raise your hand, and Chevy here can bring you a mic.
Hi, thanks a lot for the panel. So I'm one of the innovators, and I'm wondering, because you use the word success so many times, how you define it. At what point of time a program is successful compared to a program which is a failure? That's general for for anyone.
Maybe I can field that, kind of looking across the whole program. It's a great question, and it's something that we wrestle with every topic of, we really need to come up with a, maybe not singular, but nearly singular and objective metric of that. In some ways, it influences whether we think we can proceed with a topic at all. Can we actually nail down what success would look like on this? But in every case, it's really driven by kind of an outcome-oriented philosophy of, so taking, say, vaccine delivery as an example, it's really coverage of the outcome of vaccines as the metric of success, not any one of the drivers or the processes that might lead to coverage of that. And I think we can extend that logic to each of the other topic areas of, what is the end goal of that that health area? Can we capture that in an indicator and then look for usually impressive improvement in that indicator over time relative to, like I said, expectations?
Yeah, maybe I can also add to it. I mean, exactly going toward the same direction that you, David. I mean, the element of success has to be within that same program or activity. And usually what is mostly used are the outcome indicators. So is it 80% of accident, whatever it is. So we have these indicators that at the beginning of the program, you say, you know what, if we reach this level of coverage or whatever it is, then we can say that we are successful. I mean, those can be discussed here and there, but usually you want to set your target for success right at the beginning of your program. So roughly, that's these are those numbers that that you can set, and then once you reach those or go above, then you can say, you know what, we have been being successful implementing this. Thank you.
If I may add, because in emergencies, you work with a slightly different model in the sense of early on in the pandemic, we were constantly asked which countries are doing well and which countries are not doing so well. And you just think there really doesn't, and a dichotomy like that doesn't exist. This is not a program. This is elements being put together in different disease tempos around the world. Some countries had no cases and some had major generalized spread. So in that sense, success was the process that was under study, and to see if the process held solid, or if there could be an adaptation based out of the research done. And one example of success in my mind was out of Uganda, where they found that the government relied on technical advisory groups, scientists and practitioners from associations to advise on the practices to take, and that there was a tipping point there. The number of advisory groups could sometimes, if there are too many, there's too much noise. If there are too few, there's not enough advice given. So that is an example of success because it helped drive how the terms of reference, how many groups there should be, and that really is a success in my mind.
I'll just jump in to layer onto what Musa and David said. So in addition to that target, whether it's 80%, for example, for subnational vaccine coverage, I think one other point to consider is accelerated progress, because countries could start at different baselines, but which one is really scaling up impressively. And I think that's another layer that we like to consider as we define success.
Great.
Okay, thank you. I was just reflecting, I'm part of an organization who's more focused on the early stages, R&D stages. So I wonder if these all successes seem to point to access and delivery and final outcome, like, how many HIV infections averted, right? But have you deconvoluted the process? Because this is probably multiple processes that contributed to the final success. Because for me, it would be perhaps important to see success and an exemplar of each one of the processes rather than the overall. The overall sounds fine, but something that I don't have a control on.
And again, yeah, I mean, definitely, I was discussing more about success in the context of the Exemplars program, but definitely success can be, for example, if we discuss, we mentioned about the R&D, when COVID-19 came up, just the fact that we have, there was new vaccines that were discovered, that's success. You don't have to have the 70% or 80%. So, so in that case, having a, vaccine that is highly immunogenic and that prevents death, and that's success. So, yeah. So I definitely also agree that within the context, the definition of success can change.
Yeah, just to add, for each topic, really, we always go in with a certain hypothesis of what could be unlocking the success that we see over time. And like we shared from the previous session, like for the vaccine delivery process, what are some of the key factors that have driven that success, and try and map our research retrospectively. Like for most topics, we look over 2 decades and try and understand what's it looking like. For example, again, referencing the vaccine delivery work, what has improved in terms of service provision? What has improved in terms of population demand? What has improved in terms of access and awareness? So really starting off from a working framework that we can use to kind of unpack the different processes over time.
David, I wonder if you could maybe add, one thing that's come up a lot for our program is how do we think about topics where we don't have 2 decades of research and evidence and examples and history to look back at? Could you speak to that too?
Yeah, absolutely. And you're right. It is a question that we hear often when we're trying to find ways to drive towards uptake of the research. That we're looking at performance of a country, maybe a decade ago or something like that. It's an area where we're starting to explore different research models. Actually, in the COVID-19 work in particular, is really imperative to pioneer how can we do this research faster, because the pandemic is unfolding. It's going to be different in 6 months. We'll need some best practices and lessons learned now, while those countries are still exemplars. And so, it's really taken on kind of a rapid sprint-based format of, utilizing a rather vast network of key informants and available secondary data to quickly understand, like Gloria was saying, which element of the conceptual framework of various factors at different levels of proximal and distal to the outcomes appear to be contributing to any given country's performance at a given time. It's an area that I think we'll begin adopting more and more as we look at newer topics of, let's look more recent and let's try to produce the research on a timescale that is relevant to the policymakers who need it.
Thank you. Gentleman in the back.
It's Nick Casabom from IHME. I was always have been a big fan of the Exemplars project because it really is kind of taking a different tactic to try to understand what works. Much of our research is focused on individual interventions, whether they be drugs or vaccines or medications or procedures. And Exemplars is starting with the endpoint and trying to find what are the real world examples or process measures that may have actually led to an outcome. And so I'm curious about how does that actually get fed back into, it kind of strikes me as a bit of a hypothesis generation exercise in a way. How does that get fed back into the dialogue for policy making and potentially trialing these, conditional cash transfer, health force expansion sort of interventions in other places? And also simultaneously, is there any effort within these exemplar countries to then talk about trying to trial specific drugs or interventions or pharmaceuticals to see if they actually work, because a lot of our trials suggest maybe they don't.
That is a tough question. Thank you,
Well,
Nick.
yeah, yeah. I mean, for example, we had a presentation earlier where we were showing the map of Senegal and how the country has improved in vaccination coverage, and there's a little district that is left over that all the country has turned blue, and dark blue is high coverage and so forth, except the little district and the far southeast side of the country. And some of the takeoff of that is to engage the Senegalese government, but also the healthcare workers at all level of the system, at the central and the district and even peripheral level, to discuss and then see what can we do to turn the tide into this coverage in the district. So these are the things that I would say the work that we're doing is helping for. It's providing some kind of data driven information that can be used to discuss and see how we can turn things around in country. And these issues can also even be included into the country strategic plans, to see, to say, these are the areas that we want, these are the things that we want to change, and those even goes back to the sponsors, and it's so there's a whole level of activities and focus that goes into and addressing those issues that are identified in this. So roughly just giving a very concrete example, and definitely this can be changed. This can change based on if we talk about vaccine coverage or something else. How those are changed or included into policy or engage governments to change the tide can change basically. Thank you.
Yeah, I mean, maybe just to add to your point, Nick, right? There's a real opportunity in those low coverage districts to innovate and to trial different approaches to addressing the low levels of particular drivers in those areas.
The only other thing I would add on top of that is that, so as Gloria mentioned, each of the topics kicks off with the development of a really theory-driven conceptual framework of, like you said, the countries are identified based off of the outcome, and then it's a process of working back towards what might have contributed to that. The conceptual framework is intended to essentially list out all of the things that might have, and then begin eliminating or at least weighing them against each other in the exemplar countries. And what that does is then produce something that's just of use to implementers and policymakers trying to mirror the same kind of performance in new countries. It provides kind of a laundry list of what to watch out for, and then a comparison of, it was A and B, but not really C in the exemplar countries that really drove their change, and kind of a roadmap of what to focus on. But then at the same time, it also provides some information for the exemplar country themselves about what may still be lacking. If it was A and B but not C, there's maybe an opportunity for further growth in there. So that doesn't get to your question specifically about individual interventions or medicines, but every topic can then kind of dive into that level of depth based off of the theory that they set out for themselves in advance.
And maybe just to use one specific example, Nick, for our maternal and newborn health work, our research partners have gone beyond learning from just the 7 exemplar countries to really synthesizing lessons from 80 LMICs that have really made progress along the obstetric transition model, and mapped what are some of the sort of common threads for countries that have moved from stage 1 to 2 to 3 to 4 and 5. There's an updated transition model that now includes the last stage 5. So really using that tool to benchmark progress for different countries, both exemplar countries and non-exemplar countries, sort of say, where am I on the mortality transition, and what are some of the common themes that are lacking in my country, and how can I test this out to try and see if that will push me along the transition model. So that's still in progress, but that's how we're hoping to use some of our work.
Thank you very much. Santrain Pasricha from the Walter and Eliza Hall in Melbourne. Actually, the end of the last answer was what I would like to ask you again, which is around if the Exemplar project is focused on positive deviance scenarios or outcomes, how do you recognize the theoretical model for trying to understand what's driving these outcomes? Still, from my perspective, as say, as an empiric experimental type researcher, how do you know, how can you define these against at least countries that are at baseline or that are negative deviance? Do you know, how can you define what the drivers are if you don't have a control that hasn't made that change?
Yeah, so we haven't applied sort of a counterfactual lens, which I think would be really the mark to confirm that these are really the drivers of change in the positive exemplar country, or the positive outliers. So we haven't used that approach, but definitely have seen going beyond even just the high level themes. When you unpack some of the actionable unique insights in exemplar countries, we learned that there's some variation in terms of implementation when you compare across countries.
Yeah, just to add to Gloria's point, so there's an opportunity for looking at counterfactuals within those exemplar countries, right? So districts that have not made progress versus districts that have. And I think that's where some of that counterfactual analysis can be generated from.
Yeah, just to add on, I think, so every topic under the program takes kind of its own methodological path. Like I said, there's its own novel research consortium built up around that topic, and they all put their heads together about how can we quantify the relative weight of different drivers. And from one topic to the next, it's taken different forms. At times, for example, from the research into stunting reduction, it's been largely a time series based approach. At other times, it's been kind of a geospatial approach, and elsewhere, it's been kind of a combination. You're right, though, that it's lacking, and like Gloria acknowledged, comparison to peer countries. And that's kind of a new area that we're starting to explore with some of the topics that are coming around the corner. For example, we're now beginning to study exemplars in diagnostics and exploring what it might take to do that, again, on kind of a rapid sprint research scale. And what our research partners there are concluding, actually, is that that kind of cross-country comparison is really our most effective way to quickly getting to answers there. We can leverage secondary data that spans many countries and look for the indicators that represent something in the conceptual framework, but stand out only for the positive outlier countries. And so it's something that I think will begin to be adopted more and more in topics as they come online, especially, like I said, as we look to generate results on a more rapid timescale.
And I think we have 2 questions here and 1 up at the front, and probably just enough time to get through those 3. Thanks, Amy.
Yeah, thank you for a great presentation. Just looking through the list of countries that Exemplars has worked on, it strikes me that most of these are countries with a very strong donor presence. And so just curious to know a bit more about how you account for the role of donors and decision-making around health and, their potential impact on achieving some of these exemplary outcomes. And if you can provide any examples of countries that you've worked in that have successfully transitioned away from donor support and still, maintained their achievements.
I can weigh on this one, Sanjan, and I think it's a great question because we struggled with this at the beginning of the COVID, designing and selecting countries, and just as a tag member, the advice to give, because I always wanted to go for the countries that that weren't donor darling countries or weren't research heavy countries. And it is a challenge because you want to get, as Dave was saying about getting it going as quickly as you could. and so that you weren't, behind the exemplar of that country. So I think in emergencies, it's hard to do it when you're in the midst, but there's opportunity now post hoc, in a sense, to say, right, let's go back and take those experiences and build the capacity in other countries, in the non-donor darling countries, to see if then again part of that network, to be ready for the next one, can we build in advance to not have to cater for that sort of limitation.
Yeah, I mean, for me, I maybe I was going to see it differently in a way. When you need funding to successfully implement activities, so the funding that is received can be coming from the donors. It can be also internal, but you need that, that substantial funding that, coming to support the programs to have them be able to conduct the activities as planned and so forth, and being successful. I believe one key component that is important, mostly for the donor-driven countries, is to also add an element of sustainability of health system strengthening into the activity that are done. Is the idea that what's going to happen when these funds will no longer be here. And then add those elements to to activities that are implemented.
Hi, thank you guys so much for your presentation. I really appreciate it. I work at the Foundation on the Goalkeepers project, so often work with your team on trying to find good exemplars to use and highlight. Just wanted to get some, as I was reflecting on kind of how you start at the outcomes, thinking about how do you reduce bias in this research work, and are you kind of giving a global lens when you're looking for exemplars, or how do you also incorporate a local lens in trying to identify successes?
Yeah, I'm not sure if I understand well the question about the local length, but definitely for the work that we're doing in Senegal, definitely there's a we work with the Ministry of Health, for example, at the beginning, even for the planning of the activities. So, and when I say the Ministry of Health, it's not just the folks who are at the central level. It's working with people all the way up to the district and peripheral level, and make sure that we have all the inputs even before the start of the activities, and during the implementation and during the dissemination. Usually I work with our partners for these deep dissemination meetings, where we make sure that everybody in a way have their words to say, and then provide also feedback and kind of, if we can say, validate the outcome and the results that we're having. So I absolutely agree that having that local, national, if you can say, input into whatever is done from at all level of the activities is something that is key.
Yeah, I would. That's 100% correct. I would just maybe add on to that, kind of looking at the cross-country level. You're absolutely right that bias in the data is a major challenge that we have to overcome when trying to identify who the positive outliers are in the first place, especially if we try to adhere to that very outcome-driven approach to finding them. I'd say we have essentially two ways of mitigating that, and neither of them, I would admit, are perfect. I think they do leave some room for bias in the data to be misleading. But the first is relying on major efforts to correct for bias in the underlying data sources and then model outcomes. A lot of that is driven by the Institute for Health Metrics and Evaluation, but we also compare it, as much as Steve may not like us doing, to each of the kind of competing sources of model estimates, and see if there are, any sort of sensitivity analysis would rule out a positive outlier who appears to be under one data source but not another. The other is an important role for the technical advisory group, who are selected very carefully to be experts in that field and have a really good pulse on the data and the biases inherent to that data, to help guide the research partners and avoid that they're not making unwise selection of countries who may appear to be positive outliers, but only based off of biases in the data. So those are kind of two mitigation approaches that we approach, but I think we'd be the first to acknowledge that some of that limitation is still there.
And I think we have one last question up here in the front.
Thanks very much. David Anderson from the Burnett Institute in Australia. Perhaps more specifically for David, you mentioned that you're starting to look at diagnostics, and as an innovator in diagnostics, one of the challenges our partners have had is the lack of harmonization, not just in Africa, but around the world. COVID was sort of an outlier where everyone just let it rip with diagnostics, but it's a major barrier to being able to implement from your positive outliers to other countries. Is that something that you think you can look at?
It is, in fact. I'm really glad you asked that question. It's almost as if I planted that with you, which I didn't.
He didn't.
So this will be the first topic that we take on where we're actually just outright titling it Innovations and Exemplars in Diagnostics. And I think it's, coming from exactly that kind of gap in information that you're describing, where innovations in the diagnostic space are not very well standardized or harmonized, and there's not a common framework for talking about what an innovation is or what makes one good. So the idea, and it's really just kicking off in its early stages now and should continue into next year, is to, again, focus on the countries that have at an end goal performed very well empirically, but also identify and highlight some of the technologies that have come out over the past years that have been game changers in one way or another, whether they're first-in-class self-tests or really market disruptive technologies, or just the first diagnostic for a disease. Innovations that have kind of marked a turning point in the R&D space for a particular disease. And what we'll do is, after collating a series of case studies on those, then look across to form kind of a common framework of what did they all have in common? What are the parameters of a successful innovation in the diagnostic space, and try to put that out there as just a framework that's essentially a common good in itself, to try to guide future innovation.
Yeah, and I'm going to also add a little bit to it, maybe as a different angle. One of the other bias in innovative diagnostics is also the target. When COVID came up, we knew that there's a lot of significant amount of funding and money. So there's this big drive, and in a way, in a very short period of time, there was a lot of innovative diagnostics and drugs and everything that came up. But for example, when it comes up to neglected tropical diseases, there's some challenges because there's not much money out there. That's also unfortunately another bias that is not always addressed. Thank you.
So I just want to say a big thank you to everyone in the room for joining us. It's really our pleasure to be here, and a thank you to all of our panelists too for being here today. Over the course of the next few days, as you have questions, as you have ideas, new topics, new decisions coming up, please reach out. You can reach out to us at any of the contact information here, grab a handout on your tables. And thank you to all of our partners and familiar faces that are also in the room. We look forward to meeting you over the coming days, and thank you.